Advanced Heart and Vein Center was founded by a group of physicians who are passionate about providing a different and innovative model of cardiovascular care, delivered through an independent private practice. We spoke with board-certified cardiologist Dr. Kaiser Khan and his team to learn more.
The mission of Advanced Heart and Vein Center is to provide patients with compassionate, high-quality cardiovascular care in a cost-effective fashion. The clinic is based on a modern comprehensive care model that integrates multiple areas of cardiac, vascular, and vein care into one service line delivered under one roof.
The independent nature of this practice provides a unique opportunity for the patients to be cared for by the provider that is most suited and has the highest level of knowledge and skill sets for a particular condition, without being confined to the boundaries of any hospital system.
Ever since we opened in 2021, we have gradually increased the scope of our procedures and the type of the procedures that we are doing up here. We started with what we call peripheral arterial disease and procedures to look at the arteries of the legs and the veins, such as venograms, but then gradually extended that to the cardiac procedures. We started doing coronary stents, pacemakers, and defibrillators. And these are procedures that are usually and traditionally done in a hospital setting, but we think that with today's technology, they're very safe and doable in an outpatient surgery center, which the patients love because they get to go home the same day. As of last year, we just got the numbers for our last year. We did close to 1,000 cardiac procedures here with 0 major complication rates, which is much better than any hospital in town. We'll look forward to growing this practice and hoping that this could be the beginning of a new era in cardiovascular care.
We are now doing advanced cardiovascular research using cutting-edge technology to treat our patients. We are tracking all of our outcomes and openly reporting them because we believe they're the best. We're the first place of this type in the state of Colorado to do such complex cardiovascular work in the ambulatory surgical setting. We have also added advanced wound healing and wound care, heart failure, and weight management. In addition to treating patients with all aspects of heart and vascular disease, we have the opportunity to be involved in a number of clinical trials. This gives us access to new technologies that may not be available for another 4 to 5 years otherwise. Some of the examples of this include new balloons to treat patients with peripheral artery disease, new ways of treating heart artery blockages, and minimally invasive ways to do bypass procedures.
So I'm an electrophysiologist here at Advanced Heart and Vein, and I specialize in heart rhythm disorders. When you think about heart rhythm disorders, they're really electrical abnormalities within the heart. And I'd say the most common one I deal with is a thing called atrial fibrillation, but really encompasses anything: slow heart rates, fast heart rates, where you need a pacemaker, or a thing called a defibrillator. So atrial fibrillation treatment is actually very vast. I mean, it goes from treating the entire patient to pharmacologic therapy with medications. Sometimes you need a pacemaker. I'd say more commonly we do a thing called ablation, which we're mapping the short circuits inside the heart, and then we go up and cauterize those short circuits and find a fix for the problem.
We are the first and at present the only complete cardiovascular comprehensive center in the area, and we provide a wide range of cardiovascular treatments, including our new advancement in the hypertensive realm. We were just recently approved for renal denervation, which is a procedure in which we do an ablation. Amount of energy is delivered around the renal artery or the kidney artery, and that reduces the blood pressure in the majority of people undergoing this therapy. And it has been shown to decrease the amount of medications that they are on. This is immensely important, not just for blood pressure control, which has long-term consequences, but also for quality of life, because we all know that taking medications is not easy, and if we can reduce that, we know that that's going to improve quality of life. So we also do advanced comprehensive cardiac care regarding complex coronary, structural heart work, advanced peripheral arterial disease, including endovascular treatment, even in the aorta. And we are also one of the preeminent major centers in the United States for the treatment of comprehensive vein care. Everything from deep vein care to superficial vein care, and also incorporating advanced wound care management.
Providing patients with compassionate, high-quality cardiovascular care, Advanced Heart and Vein Center is based on a modern, comprehensive care model that integrates multiple areas of cardiac, vascular, and vein care, delivered under one roof.